Did you know, the most commonest conditions affecting people, which remains a global burden, do not exempt waist pain? Many people troop in many health facilities every day on account of having waist pain. Waist pain does not discriminate. Both the older and the younger populations are affected nowadays, and its debilitating symptoms are universal to both entities. As many factors account for waist pain, in my point of view, and based on my experience with treating people with waist pain, the most commonest etiological factor amongst them is bad posture. Bad posture accounts for over 50% of 100% of cases of waist pain I treat in my physiotherapy department. The reason being that many people assumes awkward postures in their activities of daily living unknowingly, which later got them into standing a higher chance for waist pain. Normally, it is through thorough education about the condition, where the issue of bad posture as being the cause of waist pain are stressed, and it's then you will realize most people with waist pain fall prey to the issue of bad posture. The important thing about this whole narrative is that, how do you treat your waist pain? How is your way of treating waist pain even effective? Did you even know waist pain is a musculoskeletal issue, and that its treatment goes beyond just drug administration? No wonder many of you end up being disappointed after taking painkillers, because you thought your pain will go away permanently after taking the drug, but this turns otherwise. Don't be dismayed, because physical therapy has come with full solution to your problem. Through personalized therapeutic exercises, education on good postural techniques, ergonomics, and the use of electrophysical modalities, physiotherapy manages waist pain with little to no adverse effect on your body functionality and mobility independence.
The best way to get your waist pain treated is through physical therapy. Since your waist pain is a musculoskeletal issue, you need exercise to engage your muscles and other soft tissues. These exercises will not only strengthen your back muscles, hip muscles, and abdominal muscles, but rather provides more stability to your spine, making it more resilient to strains, sprains, disc degeneration, and many others, which are most likely to occur via wrong positions of our body during activities of daily living.
Regardless of where your pain will be located, physiotherapy adapts very effective and side effect-free ways to help you deal with your pain. In most of the cases of pain management, heat therapy, transcutaneous electrical nerve stimulation, and massage therapy remains three main protocols you cannot avoid, especially when the pain is chronic, as in the case of using heat and TENS as your treatment protocols. However, massage can remain an adjunct treatment for acute cases too. In the next coming scene, you will see how infrared radiation therapy is used in a treatment session for chronic waist pain, as well as TENS application and massage therapy. Infrared application. Fixate the light perpendicularly to the area of pain. Though the infrared radiation may be taken as superficial heating modality, prolonged exposure of the radiation to a specific area get the heat to deep-lying tissues through the conduction mechanism. When the infrared radiation is applied, the heat helps minimize pain at the area because larger non-myelinated nerve fibers are stimulated to block pain signals carried by small myelinated nerve fibers to the brain. The heat also relaxes muscles and other soft tissues for general body relaxation, also improves circulation which facilitate the healing process. Note that, in infrared radiation application, the higher the distance of the lamp to the exposed part, the lower the intensity, and vice versa. As part of your preparation to the application of the TENS, wipe the area to be treated with alcohol. Place the electrode pads at the area just like demonstrated. Switch the machine to the TENS mode and start regulating the intensity. Use the feedback from the patient to set the intensity. The TENS helps in giving pain relief based on two mechanisms. The first mechanism is that the machine activates nerve cells which block the transmission of pain signals to the brain. The second mechanism is that the machine also induces the body to produce natural painkillers such as endorphins. It is by this reason, TENS application has been adapted in the clinical settings for the treatment of chronic pains. Following the TENS and infrared radiation application, the inclusion of massage also gives an additional relaxation effect and comfort to you. The therapist must start with a light effleurage massage to spread the analgesic gel to the area. Gently rub the gel at the area whilst picking and squeezing the muscles as many as you can to give more relaxation to the muscles at the area. Don't focus on the painful part alone. Spreading to a more wider area gives more extensive relaxation and pain relief.